Once someone makes the decision to have cataract surgery, what do they need to know about it, or what can they do to prepare for it to minimize the risks, to optimize the success of it?
Okay, I do this all the time. So many people come to me to be their advocate, to explain to them what you need to do before and after cataract surgery. Because when you go to the doctor, and they're going to give you all these different choices. Do you want a nearsighted lens in one eye and a farsighted lens in the other, so you won't need glasses? Do you want the new kind of lens that's almost a bifocal implant? Do you want astigmatism corrected if you have astigmatism in your glasses? And they walk out and their heads are spinning. Oh, that'll be $1,000 more. That'll be $2,000 more. But will it work? Will it not work? So you really need to try to figure out what is going to give you the best outcome. And the best outcome is individualized for each person. So sometimes, like with my mother-in-law, she had a lot of astigmatism, and the doctor offered her the astigmatic implant. And my recommendation to her was, no, don't get it. Just get the regular one that Medicare will pay for, and you don't have to pay anything out. But you'll still need glasses afterwards. She goes, I love wearing glasses. I don't mind wearing glasses. I just want to see clearly through them, and it hides some of my bags under my eyes. So please, let me wear glasses.
Well, so in general, is it better to just get the cataracts out, clean out the lenses, and then rather than go for the fancy stuff that may work, but potentially risky, or potentially, if you make an adjustment, like one eye, one adjustment, one eye, a different adjustment, and now you're stuck with it, right? So is it better to just go for the basic and then, again, continue wearing glasses? But that's okay. It's like fashion.
Yeah, I mean, sometimes when you get it done and you get the two eyes, then this is my recommendations. You get the best visual acuity you can for distance, okay? And then you may just need reading glasses for when you have to read. But again, it's individualized. My dad was an accountant, and he says, I like to be able to read without glasses and work on the computer without glasses. So we left him a little bit nearsighted, because you can pick your prescription. I'm really against one eye for near and one eye for far, because that will create depth perception problems and the ability to know where things are in space. In terms of the bifocal lenses and the astigmatism lenses, I've seen success with that with some of my patients, and I've seen people where it didn't really work. Technology is going to keep getting better in the future, so I don't want to say not to do that. And the people who've had it done and it's worked, they're loving it. And some people are not. So I like the tried and true right now.
Before somebody makes an extreme choice about some of these fancier adjustments, is there a way for them to simulate it beforehand, either with contact lenses or glasses?
Well, if we're doing it for the monovision, yes, you can simulate it, but since I don't like that one anyway. Right. But it's hard to simulate it because, remember, their eyes are fuzzy.
Yeah.
So they won't really know what it's like once they get it clear. But, cataract surgery, 80% of people over the age of 75 have cataracts. It's the #1 procedure for people as they get older in the United States. So the technology and the efficacy is only going to get better, because as we become an aging population, this is what's going to be needed.
Okay, great. But lots of choices.
Lots of choices, and there'll be more in the future, I'm sure.
Right. Thanks, Mark.
Bye-bye.
If you like what you just saw with Dr. Mark Grossman, come back to our website. We have a whole lot more videos with him and with our other great experts. And do me a favor, do the social thing. Share it. Tell your friends, tell your family. It's great information for all.